Good afternoon, everyone. Welcome to the Governance That Spans Boundaries session. We're thrilled to have you this afternoon to talk about one of my favorite subjects, governance. We have two enlightened leaders with us, Emodi, who's the Deputy Director at Fiscal and who has held other senior level management positions within state government and is a leader in the PMO and governance space. So welcome, Chi. And we also have Chris Jasper, who is a senior technical leader, currently working on the CalHERS project and is a principal with KPMG, correct? Was, okay, close enough. So we're going to talk about governance today. And we're going to talk about two different case studies, one involving CalHERS and the other involving the Fiscal project. So we're thrilled to learn something from the governance models that have been developed for each of those projects. For those of you who've been involved or impacted by governance, governance really is about effective decision-making, effective communication. And when it is not working effectively, it can be a little bit like telephone. So the message can get lost in translation through the process. And I think we'll have some enlightening information about how both of these projects have learned from some of the challenges they've experienced and how they have strengthened their decision-making and communication processes. So with that, I would like to ask Chris Jasper to come up and start with his presentation. Welcome, Chris.
Thank you, Bill. Well, as Bill said, my name is Chris Jasper. Thank you for coming today. I'm here to talk a little bit about the CalHERS project and some of the governance work we've done with CalHERS. You know, I think about this time of year, holidays, getting together with family, and I know that over the last several years, getting together with my family has meant taking into consideration the needs of people from age 10 to age 80, right? 15, 16 people, all different perspectives, all different needs. And that's sort of like what I think this project governance challenge reminds me of, because it isn't about finding the right answer, right? It's about finding the answer that's right for the most people or for the situation. And that's really how we tried to tackle things at CalHERS. I don't know if all of you are familiar with CalHERS, so just very briefly, CalHERS is the California Health Eligibility, Enrollment, and Retention System. So essentially the state's implementation, if you will, of Obamacare, the Federal Patient Protection and Affordable Care Act. It really, though, is rather broader than that because of all the different levels within the state that we have to administer health care benefits and some of the associated health benefits, both for the people who are, say, on Medi-Cal, those who get federal premium assistance, or even those among us who need to go out and buy our own personal health care insurance. So that's what the project is about. They're currently, right now as we speak, in their third year of open enrollment. So they've been live for a couple of years, but the enhancements and expansions of the system and the processes that go along with making that system work have continued to evolve, quite frankly. CalHERS is lucky enough to have two sponsors underwriting it, Department of Healthcare Services and Covered California, a very big, mature organization at healthcare services and a very new organization stood up just because of the federal law that was passed, Covered California. We also work very closely with the Office of Systems Integration. We also work very closely with some key partners, interface partners and process partners at Department of Social Services and the current four statewide automated welfare systems, CalWIN, C4, LEADER, and the LEADER replacement system. Fantastic partners all, play very different roles, come in at different points, but suffice to say, none of us really can do any of our jobs without the close cooperation and coordination with the others. Finally, we have quite a number of stakeholders. I've only listed a very few here. Very important stakeholder, the County Welfare Directors Association, representing all of those county workers who are helping to use our system and associated systems to deliver the benefits. the California Technology Agency, and the Department of Managed Healthcare. We have lots of other departments we're working with as well, but these are some of the ones who are closest to the fire, if you will. So very briefly, I came in with the notion of fixing governance, right? I was given 3 or 4 months to do it, and the idea was to help the sponsors, the partners, the stakeholders work better together. Heading in now to month 16 of fixing governance, there are a number of things that we've been able to do, but also a lot of things that we added to scope and learned along the way, and I'll get into those in just a bit. What we really tried to do, and see if any of these resonate either for your projects or for your family gatherings this holiday season. We were asked to help make decisions related to the CalHERS project in a timely manner, but also with the input and analysis appropriate to the people for each decision. That sounds fundamental, but first and foremost, that's what we had to get done. We also needed to establish and or reinforce consistency among the decisions. Now, I'm sure in your own experience, once a decision's made, that's it. Nobody goes back to revisit it. It's not overruled by anybody else. Everyone remembers exactly what the decision was, and it is consistently acted upon. Well, let's suppose that's not the case. I'll talk a little bit about some of the ways that we sought to improve that. And finally, a key theme was the notion of authority and accountability. Who's got the authority to make the decision, and how do we connect that with the people who are accountable for the decisions being made? I'm going to jump ahead for just 1 second, because I think this will be an important factor for helping to underscore how we got this done. We came up with a lot of recommendations, as I'm sure all of you have done in your own environments. But we realized that whether it's me coming in from the outside or the organization with whom I was primarily working, the Office of Systems Integration, or even if I represented the CalHERS project all by itself, it couldn't just be one guy's opinion on how we need to fix this. So before we started to roll out any of the recommendations that I'll share with you in just a minute, we formed what we called a Governance Improvement Advisory Team. The acronym stinks, but the fundamental idea was we wanted to get people from each of the sponsors, so both those sponsors, from OSI, and from the project team to work cohesively before we rolled out any of these ideas to help us vet them, to help us make sure that we had our understanding of the problems correct, and to make sure that the ideas we were rolling out were going to work within the constraints and the opportunities that each of those parties had to offer. I think even if you're not in a multi-party environment, this is something that might help your projects in your organization if you think about including the different divisions or branches or subunits that exist within your organization and getting them involved early. In other words, let them help you be the messenger for how these ideas are carried forth. So what did we do? What did we accomplish? The fine print that you probably can't read from the back of the room is less important here, so please don't get concerned about this. I'm not sure that the materials will be made available, but the notion here is that we changed our governance structure, all right? So the 2 yellow boxes in the stack of white boxes are where we really tried to effect the major portion of change. Originally, we had the project director for CalHERS reporting straight to the department executive directors of the 2 sponsor organizations. So a big, giant leap. A leap in terms of span of control and chain of command, but also a leap to think that the director of a 5,500 employee department can possibly understand the nuances of what a project needs for decision making, right? So we inserted a project steering committee. Deputy director level folks who run the program areas that are dependent on our project. So a little bit closer to the need, a little more understanding of what has to happen, and frankly, more accountable for what happens on our project and the decisions that shape it. The box in the lower left, we call the Program Coordination Committee. This is a critical group where we pull in those outside partners, the SAWS consortia I talked about, those other projects with whom we have to interface, some of our key stakeholders, and the sponsors to be sure that we have an understanding at a coordination level of what our decisions mean. In other words, we don't want to make the decision just to serve the CalHERS project as though it exists in a vacuum. We want to make the decisions in the best possible manner that balance off the different needs, constraints, capabilities, and capacities of all of the partners in addition to the needs we're trying to fulfill on a project. You might be familiar with this same sort of construct. It takes on different shapes and forms within a department or across, but that's been one of the foundational components that we've really had to reshape. It existed before, but we really had to refine and reshape it. Now, why did we have to reshape it? Well, when we started out this initiative, that committee, the Outlook invitation, had 137 invitees on it.
Wow.
So let's just say that it grew over time. That's not necessarily wrong, except that depending on who is available any given week, we might have 3 people one week, 3 different people the following week, 3 different people the week after that from the same organization. So going back to that notion of consistency, we didn't have the follow-through we needed. We trimmed that down to the low number of 28 people. But the key there is we established 1 or 2 designated members per organization. And those people are designated by their organization from the top level, and they know they have the responsibility to bring information to the committee, to make a good decision, and to take information back to their organization. There are other advisory members within there, but that's it. At that upper level yellow box, the project steering committee, we have a sum total of 6 people there, with only 4 decision makers. The idea being that as we escalate up in the governance structure, we have to tighten the group. The decisions get bigger, but we've got to get the focus on the people that really are going to follow through and own that decision. Whether it means they have to gather more information, or whether it means they have to be willing to take the heat for a difficult decision they make. Both these committees chartered themselves. Both are currently working the way they were intended. We've had a lot of success in both these realms. Suffice to say, that's been the foundation of a lot of very positive change in the project governance structure. We still have layered decision making, but as we put that structure in place that I just diagrammed, we also made sure that there was very clear definition from the top all the way through. So on the far left, our executive steering committee, the top level people, set the vision. Where are we going? When, what must we be there? The project steering committee says, okay, based on that direction, here's what we need to do. Here are our priorities to achieve that vision. The program coordination committee says, well, if that's what you want to do, then here are all the things I'm going to have to make happen, right, between all of our interrelated projects so that vision can be achieved. The key here, I think, is that then the project director and the management team are the ones really charged with executing the day-to-day project management. So if you're a project manager, you'd probably be pleased that you don't have your department executives telling you how to run your shop, right? But if you're a department executive, you probably want to make sure you really know who's responsible for getting done what needs to get done. So I mentioned those committees are working. I mentioned the structure is working better than it was before. We've got a reduced time for decision making. We have clearer lines of authority and accountability. Frankly, the process is working the way it should. And I know it's working the way it should because James Duckins, the project director, was supposed to be giving this presentation, but he's in a program coordination committee with some very weighty decisions today. So you see, governance is working because we've got the assigned guy on the spot to do the job that he needs to do. Thus, I'm the stand-in. We've got defined and reinforced decision-making processes. And frankly, because we've put some dedicated, specified people in those roles that understand communication has to work both ways, they now realize they're the ones who have to carry the messages back to their respective organizations. I'm not saying it always works perfectly, but they know they are supposed to be the ones accountable for taking the information back. just a couple quick lessons learned here. I talked about the advisory team up front because I do think that was very important to getting any of this to stick, right? There were lots of opinions involved, and we had to get a lot of people to buy in to make these changes. With that said, I would observe that establishing a committee de novo or from scratch, like that project steering committee that didn't previously exist, that was a lot easier to get put into place than to take that existing committee, start uninviting people, inviting different folks, and then teaching them or asking them to forget the way we used to do it, the way it's always been done, and to try something different. So as you're changing your own structures, I guess if I had to do it again, I would say maybe wipe out the committee entirely and start with something brand new so that you have an opportunity to really start fresh. And finally, I would say do plan to provide implementation support as you're going through these changes. I realize there are other sessions talking about organizational change management, so I won't get into that. But we realized that it wasn't just a matter of standing up a committee and chartering it. We actually had to really go back and reinforce some of the changes they had agreed to adopt so those changes would take root, would foster, and would turn out the way we had hoped they would. Very briefly, I know I touched on this, but we tried very hard to follow a rubric of making sure we had the right number of people depending on the type of committee we wanted. So where we had to get a large message sent out over a large landscape, sort of like this today, right? There's not a lot of dialogue, not a lot of exchange yet. A larger group works great for one direction communication. As we got down to the point of those really tricky, difficult decisions, we had to boil that group down. And I would say there, if you really want good decision making, keep the group tight. So that's it for me. I know we've got Chi coming up next, so let me see if I can cue you up here. Do you think you're this one here?
Yes.
How does that look?
Thank you.
Good afternoon. Are we excited?
Yes.
Yes.
We've all had lunch, right? So let me start with a question. How many of us make decisions every day? Every hour? Every 5 minutes? Every second? Because I believe that every time, just for the fact that we're breathing and moving and trying to sit down and deciding to come to this session, these are all decisions that we take every time. And then how many of you make decisions that impact others, not just yourself? How many of us? How many of us make decisions at work? Believe me, everybody makes decisions at work. So I'm going to be talking about fiscal as an example to kind of show what we do. Fiscal is a financial information system for California, and it's a transformation project in the areas of accounting, budgeting, procurement, and cash management. And it's made up of 4 partners from Department of Finance, General Services, Department of General Services, State Controller's Office, and State Treasurer's Office. And this is the first time we're having 4 partners, 4 departments on one project. And these are constitutional officers or governor's appointees. So imagine being in that situation where you have 4 partners, 4 sponsors. And then we have, at our steering committee team, we have the 4 sponsors, plus California Technology Agency, CALOS, who is a non-voting member. And so before we got the SI on board, we started thinking, how do we make decisions? How do we get the 4 partners to make a decision on this project or to agree to something? Because fiscal, we have the consensus model where either you step aside or at least we all agree on that decision. So it was going to be a long process. We started thinking, how do we go about it and how do we achieve success? So one good thing that we did was to establish what we call Decision Making 101. In that area, we said, okay, how do we make decisions as soon as we need it? And how do we document decisions so that 10 years, 5 years from now, Somebody can still remember who made that decision, what was the purpose of that decision, who is the intended audience. So those are the things we started, and we were thinking, oh, the SI is coming on board. That's even going to make it complex. You have finance who is dealing with budgeting, and also state controller who says, you know what, this is the way you need to do it. And sometimes they need to take decisions back to their home departments. And then we have departments that we're also deploying to, 150 something or 170 departments that we have to cater to. So those are the things we wanted to make sure. So one of the some of the critical points we have is decisions are documented when one is going to impact the scope, cost and quality or schedule, and that decision will provide clear direction. These are all the conditions under which we document those decisions, and that decision may have impact on the deliverables from the SI, and then also that it may impact our maintenance and operations. So we documented a well-written process, documented process. However, we needed to implement it, because one is you can have a matured organization with matured governance process, well documented. I think the challenge mainly is when you come to implementation of it. So we called it the ODMF, Operational Decision Making Framework, which provides us a structured approach to making that decision and documenting it. And again, we do have, not only do we have it, we use the SharePoint as a tool. So we put this, we kind of use the workflow so that at least people will know when decisions are due, when it's made, right? And who needs to be informed when any of those decisions are made. How long, when do you need it by? So we developed that workflow, and the database that we're using is the SharePoint. So, however, our ODMF does not replace any of our project management processes, does not replace our risk and issue, does not replace our change request process where other decisions are made. So normally if you look at our decision-making framework, if in the process of making that decision you need to raise a risk, it goes through a risk process. If in the process of making a risk statement and writing your risk, you find out that a decision needs to be made, we document that, hey, one of the mitigation or contingency will be to open that decision and document it. Now the question becomes, you have 300 and something people, of over 400 people on that project. Who makes decision, when, what level? So what we started doing is to have different levels of decisions. So we have level 1, level 2, level 3, level 4, level 5. And we talked about what type of decisions will level 5 make. What kind of decisions will we allow level 1? So we talked about level 1, the team members. What kind of providing them a guide to what type of decisions they can make without escalating all the way. What decisions go to managers and team leads? What type of decisions go to deputy directors and assistant deputy directors? And what decisions do we have at the project executive and then to our steering committee members? So if you look at it here, our goal is to enable decision making at the lowest level so that at least we can move things forward. We wanted to make sure that 80% of our decisions are made at level 3 or below, and that 5% is made at the steering committee level, and that 15% at the executive partners. And again, our executives are made up of our project director, our project executive, and partners from these 4 different organizations. So part of the framework we did was to kind of talk about the level, and then as you can see here, we talk about different levels. If it's impacting scope or schedule, out of our SPR, it needs to go to level 5, right? If it's impacting milestones within the project, it needs to go to this team. So we talk about who makes it and who does not make that decision. Again, we talked about where we have it, the SharePoint, so, and how it works. Team members receive an email when that decision is overdue. And I have a sample of the ODMF, sample of the decision. And components here is it has to have the title, right? Who are the owners? Who will be impacted by that decision? What is the status? Is it closed? Is it open? Is it pending? At what level? And then also we talked about what day is it required, what team is it going to be impacted, who are the participants. But the cool thing that we have is not only do you write this decision, your decision should have alternatives. What are the other options you're providing to exec so that they can make the decision and pick one of the alternatives? And then also, at what level do we need to escalate where things are not getting done? So one of the challenges we have is now everybody knows their level, they know what to do. However, we found out that initially, people were afraid to make decisions. They weren't sure whether their exec or their deputies, right, will approve of their decision. So a lot of things got bottled down at the lowest level. They were trying to get it perfect. Even for the ones that were going to go to level 4, we had bottleneck at the bottom. Because either one, they were trying to get the decision, the documentation, well written before they present to leadership. And some of them, they were also shifting all of their lower level decisions to the exec. So the exec, we met and we said, how do we continue to improve, even as a matured organization in decision making? We said, okay, one is to encourage having the deputies, encourage their team members to make a decision, and then also the ones that do go to the exec, right? It doesn't have to be pretty, because people were trying to make sure that all their spellings and all their grammar is correct before they bring it up. And then by putting the date when that decision is due, we now have weekly meetings. And we call it ODMF meeting. We come in there, and it's for exec to come in and do their votes. And what we do there is we go through the alternatives, and sometimes if they don't agree on consensus, then it goes to level 5. But 99% of the time, we'll be able to resolve decisions at the right level. So that is one thing that has been really positive for fiscal. For such a large project with large audience and stakeholders, making decisions on time that impact our operations, the systems, the decisions that the SI need to build the system. So a lot of them, whether it's SEO, whether it's DGS, anything that is impacting their own areas, everybody needs to agree so that we can weigh. And sometimes level 3 can say, you know what, level 3 has approved this alternative 1. We come into leadership and leadership weighs it and said, have you done this? Have you done this? How about this? And they may change the alternative. The other thing that we've done is both SI and the states, both of them own those decisions together. So they work on it together. As part of our workflow and our documentation, it says what is the alternative and what is the SI recommending and what is the state recommending. So if the state recommends alternative 1 and the SI recommends alternative 2, then we need to figure out why. So, and then that decision also talks about, is the impact, is it going to have cost associated with it? What level of effort will that decision take to implement? Because those are the things that we need in order to make that decision. What other things have we considered? What is the business impact? What is the technology impact? And user impact as well. So we do take a look at all of this. And I think it has really worked for fiscal to keep us going. And one good news is today we've just gone live with procurement, vendor community, for them to pre-register replacement of BitSync. Just went live today, so I wanted to share that good news with you. Thank you.
Well, thank you, Chi and Chris. Much appreciated, good presentations. But what we have now is a few additional minutes to have a dialogue, to answer some questions, to maybe seek from you what you are experiencing as governance challenges in your own organizations. If I could, I'd like to start with my own question. I don't know about you, but in my role, occasionally I get presented with a decision, and I'm always looking for it on the decision log, by the way, but I'll ask, well, where is the documentation of the decision? And I might be presented with an email or some other form of documenting it, but it isn't formally in our decision log. So I'm just curious, how do you manage sort of the informal communication, informal decision-making that inherently happens on a project but can get in the way of effective governance? So either one of you?
Start.
Okay, so for fiscal, that's a typical example. So we have log. I can tell you right now, we have about 15, close to 1,500 decisions
Wow.
in our system. And normally when you run one decision, if it has related decisions, you will know. So as soon as decision is made, normally in our decision log, it tells you who is the impacted, what is the impacted area, who needs to know, and an email gets sent out to them saying, hey, this decision has been made, it's now closed, and this is the outcome, and here is the decision number. And we have the PMO office, our office, project manager office, handling that, and they do run reports. So if you know the keywords, there are basic elements that our description must have. So if you're looking for, well, has any decision been made on cash management or cash disbursement, you can type it up and you can search. And it will pull up all the related decisions that has been made in that area.
Good.
So,
Thank you. Chris, anything to add to that?
Can you hear okay in the back, by the way? Okay, so we also have a decision log and an action item log in SharePoint, which is very helpful for being able to look up those decisions. One of the things that we really have been, and this is an ongoing effort, we really have been trying to do is encourage each of the venues where decisions are made to understand the bounds. We aren't as formal as, I like your matrix there, Chi. We aren't quite that formal. But we are trying to say, look, if you are this particular committee or you are this particular meeting group, these are the boundaries of your decision making. And if you can't make the decision here, here's your escalation path. So that we don't have the same, essentially the same decision being made in multiple places at the same
Right.
time. We're trying to really create a bright line between that to minimize the confusion about who's on first, who's supposed to make the decision versus who did make the decision.
Right. Right. I think the scope of authority question is an important one, and it's not one that you can only deal with in a charter or initially. It's an enforcement of practice. So I'm going to open it up to the audience and either ask your question, or if you have a governance challenge and you want some feedback from some of the state's experts, we'd welcome those comments or feedback. In the back.
Hi, Rob Fighter, Healthcare Services and Modernization Project. I've got a question for Chris. And on the one graphic of your committee structure, I want to confirm my understanding. It looks like the program coordination committee can bring issues to your steering committee separate from going through or having any communication potentially with the project director. Am I correctly interpreting that graphic? And I'm
Very,
wondering
very
if
close,
that's-
Rob, very close. I would say, yes, they do have a venue for escalating directly to the project steering committee. But the fact that the project director sits on the program coordination committee, it wouldn't be without his knowing, right? So there's a level of communication and understanding there before it goes to the steering committee.
Which is really what is the relationship between the project director and the committees?
Yes,
That makes
yes.
sense.
Although if I can just leverage off that, one of the reasons we made sure we didn't put the program coordination committee directly in line was because we really knew the project director had to be held accountable by that top level project steering. And we didn't want to create a false barrier, a false boundary there in between.
Excellent. Thank you. Good question. Other questions or challenges that you are experiencing yourself? Question, yes.
It's kind of for Chris, but kind of a general question. So something wasn't working right and you came in to restructure the governance. So kind of like, did everybody agree it wasn't working? And then when you restructured it, how do you make sure that people were buying into it so that it would succeed? Because any process can fail if people aren't playing their right role and not buying in. And so, it's nice to have a new structure, but how did you ensure that everybody agreed that the other one wasn't working, and that the new one, if they played right and they really put their heart into it, it was going to work?
And did everyone hear the question? Did
Okay.
everyone did? Okay.
Okay.
Go ahead.
So I wouldn't say that necessarily everybody universally said it was broken, but we talked to a lot of people in kicking off this initiative to make sure we had a proper understanding of what worked and what didn't work, right? Nothing is always one or the other. And so we built on the things that were working well and we fixed or built in place of the things that were not working. But in terms of the buy-in, part of the buy-in was simply having those conversations with all of the entities that were involved and all of the individuals who were involved. We went back multiple times, multiple iterations, to be sure that as we were sketching out new structures, as we were putting recommendations on paper, that we had it right. But that's another key place where that governance improvement advisory team came in, because if you recall, I had members from both sponsors and members from the project and members from the Office of Systems Integration, and they could go back to their respective organizations and maybe get something off the record. You know, so you met with Chris last week. What did you think? Did you like the org chart? And then we could get some good, unvarnished truth about, well, we like the org chart, except maybe you could just tweak this. And that was critical before we rolled it out and said, boom, that's it.
Excellent. And Chi, any other observations or thoughts?
I think Chris mentioned about getting them engaged. I think once you get feedback, right, make sure that you're engaging the audience and getting their feedback into how you can continue to improve and get their buy-in. Once you get their buy-in, they will make those decisions and they will provide you whether positive or negative. Take it. What you don't want to do is to put a situation where you're not allowing people to provide you negative feedback as well. If you can take it all and then come back, provide them something that they can now chew upon or review and continue to provide you that feedback. And engaging them will help.
Well, and I think one of the earlier points was making sure that decision makers own their decisions, and as the decisions go up the escalation, you can't have 50 people attempting to make a decision. You have to have clearly designated authority for the decision, and you really do need to have a smaller group conversation. So I think that came out of both your presentations. So other questions, comments, your own struggles? Yes?
When you're putting together these advisory committees that work under the decision-making committee, what kind of political, how they're listing as problems do you have, bringing people listed from locals or nonprofits or, you know, a wider array of stakeholders beyond just the primary stakeholders?
And did everyone hear that? As you're building the advisory committee, how did you ensure you had buy-in to that?
Yeah, I mean, what kind of political issues were there? You know?
And what kind of political issues? Yeah.
Some issues of like, it's hard to choose one group or the other group's bad, you know, you get all the things.
So, Chi, do you
I imagine
want?
we can both speak to that. You and start
Okay.
off, and then you give the right answer. One caveat in that illustration that I had in my presentation, I didn't show all of the possible committees and groups that might feed up into there for the simplicity's sake and for different lines of reporting. Suffice to say, they do all come in through or with the knowledge of one or more of the channels that I had in that illustration. So, not trying to dodge the question, but how do you make sure you've got all the interests involved? Well, there are other meetings that CalHERS has with a broader array of stakeholders. Some of those meetings are with the project, some of those meetings are with the project's sponsors. And based on what is heard in and filtered through those venues, those decisions or communications may come through the governance structure that I showed there. So it's a representational form of governance, if you will. The people who are not specifically illustrated on that chart know that they have a voice that finds a channel somewhere through that process.
So for fiscal, again, remember I told you guys we have 4 partners, right? And I think what we have done is for every decision, every team, you have representatives from those 4 partners. So anytime you're presenting, if your, let's say STO comes up to do presentation, and he says there's not going to impact, the other 4 partners will be there. So one of them may say, you know what, I need finance, Department of Finance to weigh into this. Therefore, can I suspend my voting on that until my folks take a look at it and make sure that we're going with the alternatives. So making sure that you have that governance where the stakeholders are involved. So even when it goes to our steering committee members, you have the 4 partners, you also have Department of Technology, and you also have the Customer Impact Committee member who is representing departments. So that when things that are going to impact department come up for our steering committee members to make a decision, that somebody can say, hey, have you talked to these departments? Fiscal, by you making this decision, you may be impacting these other departments, so you may want to, get them involved. So making sure that you have the right representatives in those decisions, will help.
Good, thank you. Other questions for our panel? Observations about your own experience with governance or implementing governance? So I think I'll leave it with one more question if I could indulge myself. So prioritization, in organizations with limited resources, prioritization is not an easy task. And there are competing priorities throughout, particularly when you're dealing with multiple agencies. So how did you touched a little bit on prioritization, but if you could just speak a little bit more on how that's managed through your governance?
I imagine you have an even broader array of priority setting. But actually, setting priorities was one of the trickiest areas that we had. So thanks, Bill. But we did have to make very clear boundary decisions about where those would be handled. And so at the Program Coordination Committee, we have a lot of discussions about the interplay of priorities. That is boiled up, and I won't go through all of the processes because there's lots and lots of steps, but that's boiled up to the Project Steering Committee that weighs those priorities of business needs, technical capabilities, timing, release dates, things that are annual, like open enrollment, and how we have to get ready for it or avoid changes during it. So
Right.
a lot of that is taken by the sponsors with a lot of input from all those other advisory members that I illustrated there. But it's a challenge. I won't try to shy away from that.
And is that a quarterly process or monthly, ongoing?
Generally quarterly, because we're doing 4 major releases a year. And we're always trying to think a couple of releases ahead and think about what the priorities for the releases 9-12 months out as
Right.
best we can. But you know what? It's a dynamic organization. Priorities change. And so there's an ongoing dialogue to make certain that we vetted the priorities correctly, that we still have the proper understanding, and what we decided previously still will carry forward.
Great, thank you. Chi?
So for us, the first thing is to have people get into the system and put in the decision, right? Put in the alternatives. And then we do run a report on what area is it impacting. So every week we have a meeting and we can look at, we're now in the design phase. We need the design document to be signed off. What decisions are impacting that design phase or that functional design or whatever it is? And then so that the decision makers can make that decision. And that's why we do have the due dates. This is the date this decision is needed by. If it's not done, here's the impact. It's going to impact our design sign-off. It's going to impact, rollout to departments. So those are the things we look at every week. And then we put it on the agenda. So, okay, here are the decisions that are due for this week. And here's the level. And sometimes, especially towards go live, we do have sometimes 3 meetings a week where we need to get leadership into the same room to make their decisions so that at least the SI can continue the work or the states, the teams can continue their work. So it's more of what area is it impacting and what is the time frame, what is our schedule, when do we need to make that decision. And then every week we run a report. These are the decisions that are overdue. And here is where it's stuck. So sometimes leadership can say, you know what? We don't need to wait for that for you to kind of make it all the pretty and get all the grammar. We know what you're trying to portray, and they can make a decision just for us to move forward.
Great. Well, I appreciate the wisdom of the panel. Chi, Emodi, thank you so much from Fiscal. Chris Jasper from First Data Corp working for CalHears. I do want to also thank Karen Covey from First Data for organizing the panel for today. And on behalf of Healthcare Services, Bill Otterbeck as moderator, thank you so much. A round of applause for our panelists. We'll stick around for a couple minutes and answer any other questions you might have. Enjoy the rest of the conference.